Good afternoon and welcome to the 27th episode of Genomics Gupshup. Genomics Gupshup is an initiative to create awareness about genomics for the average person as well as clinicians and others who want to understand genomics in more detail. Today we are delighted and honored to have Dr. Gargi Roy Goswami, who has been a pioneer in dental genetics and is now also doing many other things in terms of education and others. So welcome to the show, Dr. Gargi.
Thank you, Anu. It is a privilege for me for being on your show, and thank you for your invitation.
Thank you. And so we're going to start off with why you wanted to become a doctor in the first place, right? Who inspired you to get started in this medical field?
Well, that's a question which I have been answering every time because that is how I'm actually educated. I'm trained in genetics. I am specifically from basic sciences background. I completed my master's long back from Bangalore University in applied genetics. Then I worked in Jawaharlal Nehru University, and for some time I was in IIT Kharagpur as well. Well, then I made a shift and I studied undergraduation in dentistry. Well, the entire inspiration was my dad, and the company that I have formed now, that is Croynas, is also dedicated to him. That is Dr. Kamalesh Roy Research and Diagnostics Private Limited. So my entire family is dentist and doctors. So somehow when I was a teenager, I never wanted to carry that designation. I always wanted to do something of my own. And then I got into genetics. I have been enthusiast from very beginning. And the inspiration for getting into dentistry was just that I wanted to support my dad to run that business. But so that is how I came into dentistry. And while I started studying dentistry, and when I was, going through it, I understood that there's a lot of gap, because when I worked before in a lab, I was working actually on oral cancer cells. Day in and day out, I used to do cell culture, I do all the molecular biology stuff. But then that time I never knew that how dreadful a cancer looks like, or what are the treatment options available, because that was not needed for me. So when I studied dentistry, I came to know this disease very closely from a clinician's eye. And then I found that there is some connect where we need to do this, because the understanding of the pathology was not wholesome according to me. And from therein, as you mentioned, yes, I lived and I started something called as dental genetics. Well, I should not tell that I have discovered it or something. That area exists, just that I wanted to make people aware more about it through my endeavors. Yes, Anu. So that is in a nutshell about my interdisciplinary background. And I am enthusiastic in Saliva as well. Just out of interest, I started reading when I was a student. Yeah.
Yeah, I guess it all adds up now, right? You started in genetics. You also, so in Kharagpur, what was that? That was a master's, you said, right? Or
no, Kharagpur, I worked as it was just like like we get into the contractual project. So it was more of getting experience. So I was just a project associate. I have been working there. Yeah.
So that's another thing we have in common then.
Yes.
Yes. Except I didn't become a dentist, and I don't have that.
No, you don't have to be.
So it's very interesting, because I think I remember it was a long time back we got in touch, and I remember you were one of the first persons from the dentistry space who got in touch, and you were talking about genomics and genetics at that time.
Yes.
So I was very fascinated that you were able to bring this up, and I didn't see that same thing. Now we are starting to see that happen, right? And
yeah,
you were one of the earliest who at least got into the space and started doing a lot of work on it. So for our viewers, where do you use, from a dentist point of view, where do you use the genetic tests, right? And what are the common types of tests that you would use as a dental surgeon or a dentist?
Well, I will tell you a very blatant truth here. The thing is that the way because I have not done masters in dentistry or any specialization in dentistry. I have undergone the education of like the general dental surgery course. So anyway, that is a wholesome course in itself. But what I have found that these aspects of where we need to, as I said, that you need to understand the pathology not only from a clinician side but also from you should have an understanding. If we have understanding as a clinician about the cellular pathology more, we give a more definitive diagnosis. We help people in more proper treatment ways. And now when you ask me about genetic testing, well, I am not very sure that how many dentists actually offer. It is not about that they don't want to do. I think that they are not exposed to this fascinating field. And as you said that, yes, I visited even Hyderabad at your company also. So that was the time I got really fascinated about this, because I have been trained very well in genetics, and I know that how things can change. I mean, how more definitive diagnostics, more good predictions can be given. So with that, actually, as I said in the beginning, that I wanted to support my dad's practice, and that was always that was in rural Bengal. So you won't believe that when I started talking about genetics and genomic testing there, and obviously holding Mapmygenome's Genome Patri's hand. So that time people were like, okay, what is this doctor telling to us? But you won't believe, I got a very good response that time from a rural area where people even don't care about their teeth, forget about DNA. So in that way, I understood, well, there is a gap and we need to educate people. Same way, if you ask me that today, I would say that many people are getting interested. And when it comes to dental curriculum, it is very much technique oriented. I mean, it's a technique oriented professional course. So if we can add these flavors more, if we can educate dental professionals more, they don't have to become geneticists in one night. That is what I say. But they can take these services, they can offer to people for their own good. And we need these things on every step, whether it is we are seeing a pre-malignant lesion, even when it comes to microbiome, right? So there are a lot of stuff that can be done. As you said, that what genetic tests we can offer. Well, if you ask me again, I will tell a harsh truth here, because see, most of the things which I see, maybe my knowledge is limited, I'm a very small person, but what I see, it's more into the space of the entire systemic space. We have very little where we can talk about the oral diseases more. And when we see that, yes, at the research level, lot is happening, lot is being happening in the Western countries as well. There are a lot of products which are already launched, but I don't see that impact in our country at this moment. Maybe it will gain up very soon. So
just one quick interjection over here. So the head and neck cancers.
Yeah.
Do dentists first notice it, or is it that they go directly to it's like mouth cancers and things like that? Is that something that dentists would typically encounter, or is it mostly that they go to a GP and then they go to an oncologist?
No, I think if it is head and neck cancer, anything that is starting, any systemic problem, when it is starting in the body, if we are trained well, if we have read our books well, mouth is the first mirror which shows us that symptoms. Yes, sometimes when it is, if it is a general dentist or any specialist, it is a good idea that when they see some kind of changes, to refer to a more expert or specialist, because everything we just can't do at that point. We don't want to land up into complications. But yes, definitely we can see the reflections in the mouth, particularly when it comes to oral pre-malignant lesion. There are many conditions, not only it's related to just head and neck cancer, but maybe you have some skin lesions which would turn out to be kind of malignant, but you can understand by seeing those what to say, primary symptoms even in the oral mucosa. So that is how fascinating it is.
So one recently when I was talking to a dermatologist, she said very interesting thing, and I think that sort of stuck in my head. She said that, you know, an expert dermatologist can look at someone's skin and find out more about their health just by looking at the skin, because it's a reflection of your also an internal health, right?
Right.
So, like you mentioned, the mouth is where a lot of the things are. You can see now. What is there on the skin, all of us can see. But I think what is inside the mouth is where a dentist can really see. So, where like the early signs, they say, for instance, for early cardiac conditions and others, can be found in the oral microbiome. For instance, you mentioned that. You mentioned microbiome, so that is one of the things. But what else? What kind of warning signs do dentists normally also see, other than, of course, when they have problems with their teeth and they can't, they mostly come when they're I'm sure, in a lot of pain when they come to a dentist. But I'm sure that when you're looking at a regular somebody's, a tooth decay or something like that, you might find things that. So one was, we mentioned the head and neck, but are there other things that you can also see that?
Yeah. Definitely, that's a very good question. See, now it's not nowadays, but we are taught, like the dental curriculum teaches us this way, that we also need to understand that we have a oral systemic link. Now, when you say the two very common things which anybody, I think, we experience when we have this 32 things in our mouth, that is some gum problems. Okay, so for example, I'll give let's move away from cancer, but the very common disease, I think, which is very predominant in the Indian society is diabetes, right? So for example, just by seeing the condition of the gums, clinically looking into it, even if the patient is unaware that he is having diabetes or not, we can understand and we can tell that patient, please go and do your first you go and do your blood test for sugar, and then you come back to us. So just by seeing the gums, that is one part. Second, we can also understand by seeing the oral hygiene. Like for example, there is something called as plaque formation. Mostly it happens in the back tooth region as well as in the lower front tooth region. If many people have, it is not only about that whether you're brushing your teeth 2 times or not. There are a lot of factors. So if you have any diseases which are, if your system is actually not going on well, so that is one of the, again, first reflection. So visibly you can see gums, visibly you can see some stone-like structures that is happening. You might think, okay, I'm doing so much, but still it is happening. Okay, and third thing is also called something we called as smell, breath from your mouth. That is medically we call it as halitosis. That is bad breath, like when you really it's yucky to yeah. Yes, you feel like puking. But then these are the very visible and very common things with which we can identify debilitating or chronic diseases, like I said, that diabetes. Yes, and the third thing that is something is related to smell, that is breath, our breath from our mouth, and medically we term it as halitosis. So anything that is going wrong inside your system, just by seeing your gums, the condition of your tooth, as well as like whether there is you have a very bad oral hygiene, and the breath, because like for example, I'll tell you one example here I like to add. People who have GERD, that is gastroesophageal reflux disease. So whatever they do, even they use mouthwashes and all, they will have halitosis in the early morning when they get up, or anytime when they get up, they will have very bad halitosis, bad breath, because that is not that they are not maintaining their oral health. They might be very good at that, but still it happens, because now this is a reflection when a person is not knowing, which is something away from the normal. Okay, like this very small simple things, we can actually identify chronic diseases very well when it comes to the dental professionals. Yeah,
that's quite amazing. I think just to, for most people, I think when we think about, going to a dentist, they're going, say, I have to clean my teeth, I have this pain in my mouth and all that. But I think what people don't understand is when there's an expert medical professional, they can actually look at you and be able to make out things that are wrong
Absolutely.
otherwise, right? But I think one thing that maybe if they were not as well qualified and others, I think if they did do a genetic test, maybe sometimes they might be able to look out better for those warning signs, right? Rather than saying.
Absolutely. Absolutely.
So I think those are some of the areas that I think, maybe if they had access to testing, and especially so in rural areas, because you mentioned that even in
Yes.
a rural area, people were excited about genetic testing, and that was back in like 2016, 2017. If I'm
Yes,
not mistaken.
absolutely. It was around that time. You are right. Because what I understood is that the way you delivered this information, we need to come down to their level and explain them that why we are talking about it. So they were very fascinated to know that, okay, I just have to give my spit, not even spit, you will put something like a earbud in my mouth, and from that I will know so many things. But yes, that time maybe the cost was a factor for those kind of people, but I was really successful with 2 3 cases which I have done, and still they remember me. That is the best part, and as a clinician, that is a gift of God when people recall you for some good deed that you have done to their life. Yeah,
And I think now with the cost coming down, I think it becomes easier for people to get
absolutely
access to.
true, very true.
So, what got you excited about saliva? I mean, of course, for us, I think for Mapmygenome, we use saliva a lot, right? But you got excited about, I guess it should not be surprising given that you're a dentist, but you've actually taken saliva to the next level. So, how did you get started with that?
Okay, that's a very favorite question, Anu, and it's a very honest answer that I would give you. That there is no decoration in it, because I just started reading saliva when I was in my, I was doing my master's probably. Because that time only very few studies, were there, and I just used to read papers. Very very less papers were also there that time, because somehow due to my work, some things came up where I was searching some research papers, and I landed up on a review paper on saliva. I had no idea that time, and from that time I started reading. Then what I saw, that with this biofluid, that it is no, I mean, there is nothing that we can do with this bio. Everything is possible, like we talk about blood, because this biofluid has a lot of areas of applications. It's not only just by seeing about a disease diagnostics is there, even addiction, you name anything, you forensics, then even environmental toxicity. I mean, where it is not there. So that way I developed an interest, and I used to read random papers, and I used to note them down just out of my interest. Okay, so in this process, I saw that there has been a growth. Now people talk about saliva test, or they are working on it for diseases like Alzheimer's, dementia. I mean, this is wonderful. I mean, this is something, a game changer kind of a thing. So with that context, when I started reading as a student, as I said, so when I had some inquisitive questions in my mind, just out of curiosity, so well, this is your gupshup, but then I think this would be something very silly, but then I would really like to share as well. But what I used to do,
You can share whatever you want.
yeah. So I used to share my questions to those particular authors who were the first author, whomever the corresponding address I would give, and many of them did reply. So by the time when it was 2018, 2017, 2018, and that is how, through search, I also came to know about Mapmygenome, to be very honest. And then I thought, oh, there is a company who also works in saliva. How fascinating it could be. Well, after that, then what I thought, that can we, what's happening in India? So when I saw that in dentistry, some studies people do, like as a student, they will do their thesis work and stuff, just because that it's very easy to collect samples. But then I thought that, what can we do about it? Something can be done in the country, something, at least awareness, some education. So in this process, I came across I came to know about North American Saliva Symposium, which started in 2014, and I used my same methodology to approach the founders, and they were very good people, I should say. And at this moment, I'm very fortunate that I can call them as my friend philosopher guide. They're very close to me right now. So I asked them that, is it possible to do this thing in India? Is it possible that we can do something like this in India? And out of nowhere, it was a yes. And then I got extremely excited. And I did the first International Saliva Summit of India in Chennai. So 2019 was my start. 2020, I did it in IISc Bangalore. My idea was that I take it to different, areas, different states, cities in India. But yes, always there are some challenges, and the biggest challenge for all of us is COVID.
Yeah.
COVID came down. And just after I call it a SALSI, Saliva Summit India. So after SALSI 2020, COVID came in. But then we didn't stop. We are still doing it online. And we're just waiting for the right time to bring it back again in the in-person mode. So that my idea through this platform is to create a buzz and bridge all people together and let people collaborate and let science expand. That is my only mission with this.
I think that's a wonderful vision. So it's not a small, it's a nice, big, wonderful vision that you have. Right. So you've also been doing a lot of awareness activities, right? I mean,
Yeah.
I saw that you have been doing this newsletter. You also have a whole 50 series. I mean, a lot of episodes that you've been able to do. So
Yeah.
how did you get into? I mean, did you have any specific aim when you started it, or is it more like you said for the sake of science, or hoping to expand, the scope of collaboration, or what got you started in doing, all those newsletters and creating awareness and everything else?
Yes. So Anu, this is something which I would really like to answer, because this is a question which touches my heart. So whatever I did till today, as I said, that is just a start of my journey. I haven't achieved much. But then the thing is that whatever I did, I just wanted to focus on fostering interdisciplinary science, and from there in awareness about this importance of interdisciplinary science. That was my first beginning, because I had myself gone through this experience. Like I studied two different type of entirely different type of subjects in subject matter expert. If you tell dentist will not come to a genetics background, genetics is not going to come. But then when I've gone through this journey, I understood that it is we demarcate these things. It is important that somebody should show this bridge. So that was my first thing. And the newsletter or the e-magazine, that is GENOMEDEN, that you were talking about, I just started it with the same vision, because I think it is important that we are doing science. It is at the same time, it is also important to tell people what we are doing. Because today you are doing one discovery. If my mother or grandmother is not able to understand that, then I think just publishing in a journal and keeping it in the library, it's not justice to that wonderful science. So I think that has been my passion. And for Eclectica, the interview show, again, is the same thing. And yes, I started during COVID. I am a people's person. I used to feel extremely confined. The earlier days were fine, but I was like, okay, I cannot meet everybody.
Confined to confined.
That was wonderful. So that is how I just started. And yes, now what I do is that there is no specific intention here, but I since I am an enthusiast in particularly in these fields of genomics, genetics, you can say that I wanted to learn more about industries, how industries work, and what scopes can be there for new beginners or anything like that. So that is how my journey has been. And now I'm very much focused towards understanding more of the genomics, precision medicine and everything, because this is extremely fascinating. And I think we are just heading, it's not future anymore. That is what I feel now.
Absolutely. I think the future is here already. So,
Yes.
so I think you've been doing absolutely wonderful work. And if there's something that you would like to tell our audience in terms of, both in terms of how you feel this area is good. And I think, very few people have made that jump from genetics to medicine. I think some people have done medicine to PhD
Yes.
as well, but I think I have not seen that many people who first started with genetics and then moved to becoming a doctor. So I think that's fantastic because I think it sort of builds that bridge, and I think we need that more so now with this whole new science of genomics and
Yes.
the whole medical world changing quite drastically, and education plays a huge role. So great job in getting that done and getting the international conference on saliva here. SALSI is what you call it, right?
Yeah. Yeah.
So I think do let us know if you have any other words of advice or something that you would like to tell the audience.
Yeah, it's not an advice. This is my perspective, how I see things, how I see science. I would like to share that. The thing is that whether you are coming from a life science background, you have a background in genetics, genomics, molecular biology, biochemistry, whatever, or any data science or something, whatever, if you are interested in the human biology, you also have, I mean, you have to see it from a different perspective, not just that what you have learned and you have to understand how it works, how you can use your knowledge for the benefit of the society, or maybe just treating one person. So if you have to do that, you also need to understand a little bit of pathology. So I mean, I'm not telling about seeing the microscope and stuff, but you have to understand where the human system goes wrong. So that is one side. Same thing I would say for people who are trained as medical professionals or dental professionals. You have to see this thing in a wholesome way. I think it is not actually fault of anyone, but if we make our individual efforts also, we can change 100 lives, and those 100 will go to 10,000s. So that is how a revolution happens. So it's just that we change our perspective a bit. Instead of becoming converging, let us be little more wider in seeing things, as well as getting into more holistic approach, because that gives and that actually fills the small gaps that are still existing, because interdisciplinary or multidisciplinary is the only way forward, where we can actually solve real life problems. This is my understanding. So yeah, that is all from my side.
Great. So I'll ask you one last question before I move to the rapid fire. Okay.
Oh.
You didn't know that. This came
No, this is a surprise.
Okay. So in your words, what is prevention in health?
What is
other
prevention?
things.
Okay. I think prevention is something where you can just stop the particular pathology to a certain extent. Earlier you diagnose it, better you can change it. It is not always about true medicines, but there are many other holistic approaches. Just by changing your food or lifestyle, you can do it. Yeah. So I think that is how I will tell prevention.
Okay, thank you. So let me move to my favorite part of the show.
Oh my God.
No, it's not. I haven't prepared any difficult questions for you.
Okay.
I'm just making up stuff as I go along. So can you tell us about your favorite book or movie?
My favorite book is Atomic Habits.
I've read that also.
It is a fantastic book. Yeah.
Okay. So which time of the day are you most productive, morning or night?
I am very productive early morning.
I think I'm seeing that more than the late nights. Okay. So the third is if you and I think in your case it really doesn't make any sense. We already we're gone from genetics to this, but if you were not a dentist and not a geneticist, what would you be?
Yeah, I would be a chef.
Great. And what would your favorite food dish be over there?
Biryani.
Biryani? Bengali biryani or Hyderabadi biryani?
Kolkata biryani. No.
Kolkata
Kolkata
biryani.
biryani. That is the best. in the world.
All right, great. So with that, I think, I was just making this fun last few questions, but thank you so much. It has been a pleasure having you on the show, and hopefully we'll get to meet up in person sometime.
Definitely. Thank you, Anu. It's an honor for me to be on your show. Thank you.